It was reminiscent of being in a dentist's office. And I remember the top of my head tingling, and I just sort of popped out of the top of my head. And I was then looking down at the body. I knew it was my body, but I didn't care. My vantage point was sort of sitting on the doctor's shoulder. I remember the instrument in his hand. It looked like the handle to my electric toothbrush. I had assumed that they were going to open the skull with a saw. I had heard the term saw, but what I saw looked a lot more like a drill than a saw. It even had little bits that were kept in this case that looked like the case that my father stored his socket wrenches in when I was a child. And I remember distinctly hearing a female voice saying,
"We have a problem. Our arteries are too small."
Try the other side.
It seemed to come from further down on the table. I do remember wondering, what are they doing? Because this is brain surgery. And what had happened was they accessed the femoral arteries in order to drain the blood. And I did not understand that.
In the process of my study, I went and interviewed Dr. Spetzler and looked at his operative report, and I found that what she saw from her out-of-body experience seemingly corresponded very accurately to what had actually occurred. She looked at the bone saw that was being used to cut open her skull. I didn't have any idea what this thing looked like. She described it as an electric toothbrush, which I thought was ridiculous. I had to send off for a picture of this saw to Fort Worth, Texas, to confirm whether or not what she said it looked like actually was accurate. And I was astounded when I saw the picture. It indeed does resemble an electric toothbrush.
I don't think that the observations she made were based on what she experienced as she went into the operating room theater. They were just not available to her. For example, the drill and so on, those things are all covered up. They're not visible. They were inside their packages. You really don't begin to open until the patient is completely asleep so that you maintain a sterile environment.
She also heard a conversation during the operation between Dr. Spetzler and the cardiovascular surgeons who were cutting into her legs to hook her up to the heart-lung machine. When the cardiac surgeon incised her right groin, she found that her veins and arteries were too small, and she had to go over to the left side. And there was some conversation at the time between the doctors. Pam accurately recalled hearing that conversation.
At that stage in the operation, nobody can observe, hear in that state. And I find it inconceivable that your normal senses, such as hearing, let alone the fact that she had clicking modules in each ear, that there was any way for her to hear those through normal auditory pathways.
So again, this is very suggestive of the fact that there was some sort of extrasensory perception or out-of-body experience or whatever occurring at the time that was allowing Pam to hear accurately and seemingly see accurately what was going on in the operating room at the time.